In the topic of spinal cord, we discussed extensively about the site of lumbar puncture and the structures that is pierced during lumbar puncture. What is drawn during lumbar puncture is the cerebrospinal fluid. Now this cerebrospinal fluid is drawn from the subarachnoid space, which is enlarged in the form of a subarachnoid cistern, which in the lumbar part of the vertebral column called as lumbar cistern. Now where exactly this CSF is produced? How exactly the CSF is circulated? Answers to these questions can be found once we learn about the anatomy of the ventricles of the brain. Yes, ventricles of the brain are the sites where the CSF is produced and then gets circulated until it reaches the subarachnoid cisterns, the central canal and the subarachnoid space. So in this session, let's try to find about the anatomy of the ventricular system. In this session, we will focus on the anatomy of the lateral ventricles of the brain. Now, the learning objectives for this session will be, first we'll try to describe where exactly the lateral ventricle is located, what are the parts of the lateral ventricle, what are the important structures to which lateral ventricle is related, and then what are the communications of the lateral ventricle, and then we'll talk about the clinical anatomy associated with lateral ventricle. Lateral ventricle could be an important 10 marker for you or a 5 marker question, but lateral ventricle is a very important topic for your entrance exam if you are writing, because lot of MCQs are asked from this topic, right? Let's try to understand what exactly is lateral ventricle first. Lateral ventricle are paired C-shaped cavities. So the first thing we need to understand here is lateral ventricles are paired structures. So one lateral ventricle is present in the right cerebral hemisphere and one is present in the left cerebral hemisphere. These are C-shaped cavities, right? As we can see, these roughly look like C-shaped cavities which are located within each cerebral hemisphere. Lateral ventricle mark the beginning of the ventricular system of the brain. These two lateral ventricles are connected by the interventricular foramen of Monro with the third ventricle, which is a median chamber. So lateral ventricles are paired. The median ventricle or the third ventricle is a median structure. The third ventricle is further communicated with the fourth ventricle, which is again a midline structure, and this connection is through the cerebral aqueduct, right? The fourth ventricle is further connected with the spinal subarachnoid cisterns by means of 3 apertures which lie on the roof of the fourth ventricle, which are the Foramen of Magendie and the Foramen of Luschka. Magendie is present in midline and Luschka are 2 foramens which are present on the lateral part of roof of the fourth ventricle. So this is how CSF, which is produced in the lateral ventricle, reaches the third ventricle, then reaches the fourth ventricle, and from the fourth ventricle it comes out through these apertures in the roof to enter into the spinal subarachnoid space. One more continuation or communication is the fourth ventricle will communicate further down as central canal. So this is how the CSF will be present in the center of the spinal cord, and through the apertures in the roof of the fourth ventricle, the CSF spreads into the subarachnoid cisterns first, which are present around the brain, and then the subarachnoid space which is present around the spinal cord. So this is regarding the lateral ventricle and how the circulation of CSF occurs once it is produced in the lateral ventricle.